It is time for money, power, politics. Contrary to what the president claims, grocery prices are on the rise. But never fear, Agriculture Secretary Brooke Rollins has a cost-saving solution for Americans that also follows new dietary guidelines. Watch this.
We've run over 1,000 simulations. It can cost around $3 a meal for a piece of chicken, a piece of broccoli, corn tortilla, and one other thing. And so there is a way to do this that actually will save the average American consumer money.
Let's discuss with Natasha Surin, former Treasury official and Yale law professor, and Justin Wolfers, a professor of economics and public policy at University of Michigan. It's great to have you both. So, Natasha, I'm already laughing because of the concept of a single piece of broccoli and one piece of tortilla. But the funny thing about it to me is that we were just talking about regime change and the Trump administration's actions in Latin America. That sounds a whole lot like Latin American despots. Yeah. They love to tell people, you're going to get these rations per month. We're going to give you this. You can have this much milk for your family. You get this one piece of broccoli. Do they not see the irony here at all?
You know, and it comes from an administration who's also told people that they can have 2 dolls and 1 pencil and versions of how to deal with the affordability crisis that really does feel front of mind for the American people. And something that I just find so surprising is like the 2024 presidential election was about the fact, in large part, that the American people felt like prices were high and rising, and when they went to the grocery store, they looked at the cost of milk and the cost of eggs and the cost of beef, and it felt like those costs were high. And in response to that, what you've seen from this administration is not steps taken to address those problems. It's actually steps taken to make them all worse in the form of these tariffs that are at their highest level that we've seen in the last century.
Another piece, of course, of this affordability puzzle, Justin, is healthcare. And we know that already we're seeing these major enrollment drop-offs from the ACA marketplace. We knew this was coming because people looked at their numbers. They got their letters, knew they could no longer afford it without the subsidies. And we were going to see this rising population of potentially uninsured people. But Trump has unveiled his solution that we kept hearing for years was like 2 weeks away. It's finally here. And the plan is basically to put money in Americans' pockets and trust them to make decisions to go out there, spend that money in the marketplace. Do you think that logic is really going to apply to work with healthcare for Americans?
I think we shouldn't take this plan any more seriously than the president did. It's 823 words. I counted them. I'll tell you some words that are not in it. Pre-existing conditions. How could you have a healthcare plan without pre-existing conditions? You know what else? Medicaid, Medicare. The word Trump is there a lot, by the way, but words like health and things that we really care about really aren't there at all. So, mate, look, I've got a 7th grader at home, and sometimes it is the night before an assignment's due, and sometimes he will put together 823 words. And to be honest, they're a little more comprehensive. Sometimes my son, at least, he'd tell you how much it costs. He'd tell you the sort of coverage you should expect, who's going to be in and who's going to be out. He might even tell you how we're going to pay for it. Not for the president, though.
So, Natasha, what happens when you have a rising population of uninsured people in this country? How does that impact our economy?
So we know, in fact, that the result of the fact that millions of Americans are going to lose health insurance as a result of some of the choices that this administration has been proponing, it is going to translate into worse health outcomes for the American people. It is going to mean hundreds of thousands of lives lost earlier than they need to be as a result of the fact that Americans don't have the type of health insurance coverage that they had previously. And it's also going to mean higher costs for those who do have health insurance coverage as a result of what the expiration of the ACA marketplace subsidies at the end of last year. We have 22 million Americans who are facing higher premiums today than they did at last year and the years prior. And that actually matters to people at a moment when affordability is this issue that is so salient to them. Housing costs are high, food prices are high, the cost of apparel is high, and the cost of health insurance is high. And I worry that these aren't just sort of like concepts that are there in the ether. These are actually like tangible things that people are going to feel and be responsive to as they look and see what they demand of their political leaders in the months ahead.
Justin, even if this administration is not particularly passionate about health care and making sure that all Americans are insured, if you put sort of the moral, the fuzzy pieces of this aside for a second, and you just think about the sort of cold, hard financial and economic pieces of this, in addition to rising costs just for everyday people, this is going to put immense pressure on hospital systems, no?
If people are not insured and they turn up in the emergency room, that's going to be a whole lot more cost. So, look, the thing is either people end up getting less care, we think that's probably bad, or they get the same amount of care, but we still haven't answered the question, who's going to end up paying? And so the thing is, medical care is expensive, and if people are in the emergency room, that's going to cost a whole heck of a lot. More pressure on the system, as Natasha said. I think there's actually two issues here. One is what's happening to your health. Are you being taken care of? Are you getting the care you need? And the second is what's happening to your finances. Because for too many Americans, if they're uninsured, one accident at work, one bad illness, a cancer diagnosis is bankruptcy for their families.